Hello, my name is Eddie Husky, and I'm a relationship manager here at Guidestone. Today we're going to talk about Step 3, Pick a Plan, 4 steps to finding the right medical coverage for your staff. We're going to take a look at why it's important to compare plans in the marketplace, and we're going to look at the 4 most common plans to choose from. So why is it important to pick plans? Comparing is simply good stewardship. You would never purchase a new church building without taking a look first at the church building itself, doing a thorough tour, and also looking at an inspection report. Same goes for your medical plan coverage. What are the 4 most common plan designs? Today we're going to look at health maintenance organizations, or HMOs, preferred provider organizations, or PPOs, federally qualified high-deductible healthcare plans, and finally, narrow network plans, relatively new on the marketplace. So what is an HMO, or a health maintenance organization? These types of plans have been around since the 1980s. These plans come with their own set of specific network of doctors and hospitals that have a predetermined and agreed upon cost. Now, this type of arrangement allows for the HMO to keep its costs down for members and in turn your employees. You may have heard of some of the most popular HMOs available today, including the Kaiser Foundation, United Health, as well as Cigna. What sets the HMO apart? Cost. You as an employer will enjoy lower upfront premiums for these types of plans. Your employees will enjoy lower copays as well as lower coinsurance. In the end goal is to deliver quality care at an agreed upon cost. Another factor that sets the HMO apart is choice. Participants must use a primary care physician or PCP that's in the HMO's network. Now, sometimes these HMOs are not easy to find. It's important for you to understand that finding a PCP that's in network is something that your employees may experience as a difficulty when looking at these types of plans. Secondly, there's limited access to specialists. Employees would have to see first their PCP before getting a referral to see a specialist. Finally, out-of-network costs are typically not covered by HMO plans. This is something that could cause confusion and frustration for your employees, as most other types of plans cover out-of-network costs at some level. But an HMO might be the right plan for you if your ministry is looking for plan savings, if you have a reliable HMO in your geographical region, because remember, certain regions may not have access to HMO networks, and make sure that your ministry is typically healthy and that they don't mind getting a coordination with a primary care physician in order to seek for additional care. That's super important. Next, we're going to look at preferred provider organization, or PPO plan. These types of plans typically have a much broader network of doctors and hospitals versus an HMO provider. As a result, they typically also have a higher cost. Now, the largest PPO providers you may already be familiar with include Blue Cross Blue Shield, Aetna, Cigna, and United Healthcare. A large majority of employer-provided healthcare plans are PPO plans, and so if you have someone coming to your ministry from the secular market, they may already be familiar with PPO plans. Let's look at some differences between these plans. Number 1, cost. Because they do offer such a robust network, they are going to be more expensive than that of an HMO plan. Members also have an additional out-of-pocket expense, including deductibles, copay, and coinsurance. Now, the typical deductible in the marketplace is a $2,000 deductible. This isn't something that you would experience with the HMO plan, which typically is comprised of just copays or coinsurance. Another thing that sets the PPO apart is flexibility. PPOs do offer a broad network of providers when comparing them with HMO plans. Also, participants may see a specialist without a referral. Again, another benefit to these types of plans. There are fewer restrictions for out-of-network expenses with these types of plans, which are covered at a higher out-of-pocket cost. For example, with HMO plans, you may have no coverage for out-of-network services, or with PPO plans, you may have as much as a 50% out-of-network coverage. So a PPO might be right for you if you want to provide a robust and comprehensive network. It also might be right if you live in a rural area or your employees live in a rural area and you have restrictions for HMO networks. Typically, HMO networks are available in larger cities, so this is something to think about. For employees and their families who need access to more specialized care, such as cancer care or heart disease care, you may also want to look at the PPO plan, as you're going to have greater access to MD Anderson or the Mayo Clinic, for example. Next, let's look at the federally qualified high-deductible healthcare plans. These types of plans have been around since the early 2000s and are meant to be paired with a health savings account or an HSA. Now, these plans are becoming increasingly popular with large employers, especially large churches, as many will also pair a PPO plan option for their employees to take a look at to pick which plan is best for their needs. What sets these types of plans apart? Well, first and foremost, cost. You are going to experience lower monthly premiums with these types of plans when comparing with the HMO or the PPO plans. These types of plans are really right in the middle. It's probably going to be more expensive than an HMO, but less expensive than a PPO network would be. There's also a potential for more upfront expenses. And so by that, we mean that the employees would have to pay a deductible before the plan would pay out, whereas with the PPO plan or the HMO, they would experience a copay. So it's very different, and you need to make sure that your employees understand the difference between these. Now more than ever, employees are able to shop for their coverage like never before. With just a click away, they can see exactly how much an MRI or a CAT scan is going to cost with their plan, and so this puts them in the driver's seat. If your employees are willing to shop for lower cost services, that's less out of your pocket as the employer. Another factor that sets these plans apart are benefit structures. The deductible must be met before the plan begins to pay out benefits. Now, this is very different than the other two plans that we've talked about. There are also no copays for services or prescriptions. Instead, costs are applied towards the deductible. What that means is your people that may have been on a PPO plan before are going to have to pay the full cost of a prescription or an office visit where they may have been used to paying a copay in the past. This type of benefit arrangement allows for your employees to shop for coverage. That means more money in your pocket as well as theirs. Keep in mind that a qualified high deductible plan is meant to be paired with a health savings account or an HSA. These HSAs have triple tax advantages, and by that, we mean that the employee contributions are tax deductible. Disbursements for eligible medical expenses are also non-taxable. And finally, HSA investment earnings are tax-free. That means that your employees have a triple tax advantage. Who would not want to take advantage of that? So is a qualified high deductible plan right for you? If you want to save premium dollars, if your employees are comfortable with a tax-advantaged HSA, or if your staff is generally healthy with few chronic medical or prescription needs, this may be the plan. Finally, we're going to take a look at narrow network plans. These types of plans are relatively new to the marketplace and are somewhat of a hybrid between the HMO and the PPO plans. With this type of plan, you don't have to be referred by a PCP if you want to get a specialist visit, but you are going to have an extremely narrow network. That's where you're going to see the cost savings. Now, these plans are sometimes called local plans, meaning that if you go outside of your local area, you may not have coverage. So when reviewing these types of plans alongside, say, a PPO plan or an HMO plan option, and if it seems less expensive for you, well, there's a reason why. It's because these types of plans have very narrow networks, which cause them to cost quite a bit less. So what sets the narrow network plan apart? Well, as with the others, cost. Employers can save up to 16% in premiums. Now, remember, your employees are going to have limited access to providers and predetermined costs to keep the cost down, so there is a trade-off. Also, these networks are typically very limited or narrow with their number of providers that are in network. Many of these only provide coverage for between 10 and 25% of local providers, compared with up to 70% of local providers in robust PPO plans, for example. Many become limited geographically as well and require participants to travel farther when seeking a specialist. So keep this in mind, especially if you have multiple campuses for your church, as many of them might not have access to care in the event that they needed it. Another important element to the narrow network plan is definition. What I mean by definition is that these plans are not always easy to define. When looking at this type of plan versus a PPO plan, they may look the same on paper, but the narrow network may have a very restricted network of doctors and hospitals. So it's important to do your homework before you sign up. Once again, these are not easy to spot, so make sure that you ask questions before signing up for any type of medical plan. It's important to understand the plan features, especially when looking at out-of-network care and networks in general. A narrow network might be right for you if you are trying to save premium dollars, but make sure that you're close in proximity to the providers and make sure that the narrow network makes sense for you. Also, your employees need to be willing to change providers, as the narrow network typically doesn't have a large network of doctors or hospitals in the network. So keep that in mind when you're choosing this type of plan. Thank you for joining me today. I appreciate your time. I know that we've gone through a lot of details and a lot of information. Please feel free to reach out to our professionals at Guidestone if you have any additional questions, as we're always happy to help. God bless.